The death certificate might not say COVID on it, but it's probably related.
Some new information is out about the number of deaths attributed to coronavirus, and you've been looking into that. Generally speaking, in our neck of the woods, particularly Oregon and Washington, what are those numbers saying?
Well, I looked into the concern that maybe the official case count and death toll isn't fully capturing the extent of the pandemic. And the way medical professionals look into this is something called excess deaths. So they looked for, and we asked for the data on deaths from all causes, not just COVID-19, since the pandemic started. And it's kind of interesting. There is definitely a surge of deaths other than COVID that kind of track with that peak that we had in late March, April, early May from COVID deaths, from people dying from other things. And the question is that collateral damage, or maybe there were a lot of uncounted or missed COVID cases?
And it's known that COVID-19 adversely affects populations who are older, 65 and above, more heavily, people with underlying health conditions, of course. And in these excess deaths that are so far unattributed officially to COVID-19, is that the same case? Is it also affecting people of that advanced age?
Could well be. There's a high suspicion that some or most of these are unrecognized COVID cases. I mean, a lot of them came in the long-term care homes, nursing homes, where COVID just was on fire periodically this spring. The Centers for Disease Control has the analysis of the death certificates, and we looked at that for Washington and Oregon, and there's a noticeable representation of Alzheimer's and dementia cases there as cause of death, strokes, diabetes, heart disease, things that, you know, in many cases, the person would be fragile to begin with, and then along comes the disruption of the pandemic, and their family can't visit them anymore. They're isolated in their rooms with maybe just visits to have food delivered all day long. So there's loneliness and now abandonment. All of them might send somebody spiraling down faster. The death certificate might not say COVID on it, but it's probably related.
I wonder if now sort of these excess deaths, as we've talked about them, are now able to be caught, perhaps because we know so much about what to look out for, and that might not be the case going forward into the summer and fall.
Yes, absolutely. The epidemiologists are definitely on the watch for this. The death rate has gone down, and with it, you know, overall deaths now appear to be in the normal range again for all three of our Northwest states. We should add that when you get into the recent weeks, the deaths data is really pretty preliminary. Now, it takes a while for death certificates sometimes to be processed and cataloged. So it's a little hard to say what's happening in June and here in the first half of July, but it does look like we're in better shape. The increased amount of testing may be a big part of that.
Well, I wanted to ask about the increased amount of testing. That's sort of been talked about for a long time as not necessarily a panacea, a cure-all for everything, but something that was greatly needed throughout the entire country. And now that testing capacity, in theory, has increased, has that ability, particularly in like long-term care facilities, sort of given health officials the ability to catch these sorts of things very early on and solve them before they turn into deaths. So is it solely attributed to increased testing capacity, or are there other factors at play?
Certainly testing is better. I heard just this week from this National Nursing Home Group, as well as from the Alzheimer's Association, that testing still needs to improve further. There's some frustration that, say, professional athletes that are now getting back into action can get tested every other day. And yet we've just completed a few weeks ago the first statewide sweep through testing all staff and residents in nursing homes in Washington State. So there's more to do for sure yet.
There is, and we will certainly look forward to hearing from you about it when you are there to report on it. Thanks for joining us today, Tom.
You're welcome.
You can see more on these and other stories and more coronavirus updates and resources at our website, nwpb.org. Thank you for joining us here in the unique Northwest.